In past years, I've addressed the most pressing dietary issues of our time. Like, what's the healthiest variety of apple? Or what's the most nutritious nut? Or dried fruit? Or what's the best bean? What's the best berry? What's the best bowel movement? Right? We had fun. People got to vote. You know, some folk came away all huffy, you know, especially the New Yorkers back there. But this year I thought I'd lighten it up and answer, what's the best way to prevent death? Every year the CDC updates the latest leading causes of death in the United States. So let's start at the top and go down the list, see what's new in each category. Heart disease, number one, the 35-year follow-up of the Harvard Nurses' Health Study just published. Now, the most definitive long-term study on older women's health we have. Since the study started, thousands of participants died, but that allowed them to study the risk factors for mortality. Because heart disease was the leading cause of death, it comes as no surprise that dietary cholesterol intake, right, was a significant risk factor for dying. The second leading cause was smoking-related cancer deaths. But what's so neat about this study is that it's a competing risks analysis. Right? So it allowed them to compare different risks to one another. So consuming the amount of cholesterol found in just a single egg a day appears to cut a woman's life short as much as smoking 5 cigarettes a day for 15 years. The most protective behavior they found was fiber consumption. Eating just a cup of oatmeal's worth of fiber a day appears to extend a woman's life as much as 4 hours of jogging a week. Though you can do both. So it's worth noting that, look, the intake of cholesterol only found in animal foods was associated with living a shorter life, and the intake of fiber only found in plant foods associated with living a longer life. The one specific food most tied to longevity was nuts. You also appear to get 4 hours of weekly jogging benefit eating just 2 handfuls of nuts a week. All right. Yeah, heart disease, number one cause of death, but what if your cholesterol is normal? Right? Hear that all the time from patients, right? Have to break it to them. Look, having a normal cholesterol in a society where it's normal to drop dead of a heart attack, not necessarily a good thing. And remember, it's our number one killer, right? In a huge study last year, most heart attack patients fell within the recommended targets for cholesterol, demonstrating that the current diet guidelines just are not low enough to cut heart attack risk. Close to half of heart attack victims had cholesterol levels classified in the guidelines as optimal, though I'm not sure their grieving spouses and orphan children will take much comfort in that fact. What is considered optimal is still way too high. Yeah, having a below average cholesterol, reduces your risk, but as the editor-in-chief of the American Journal of Cardiology wrote more than a decade ago, it's time to shift, right, from just decreasing risk to actually preventing and arresting atherosclerosis. We don't want low risk, we want no risk. How do you do it? Well, for the buildup of plaque in our arteries to cease, it appears that we have to get our total cholesterol down to be about 150, right? In other words, the cholesterol must be lowered to that of your average pure vegetarian. Now, but because relatively few people are willing to abide by the vegetarian lifestyle, drugs are required, to get down to similar levels, right? So it's our choice. Now notice though, even though the average vegan has a cholesterol of 150, it doesn't mean that all vegans have 150. That's why I do free cholesterol screenings here at Summerfest. Stop by my table, little drop of blood, just take a couple minutes. I'd be happy to do that for you. All right, so it's our choice, diet or drugs. why not just choose the drugs, right? Well, no, that's a good question. Well, as the good doctor noted last night, the FDA just announced newly mandated safety labeling by law to cholesterol-lowering statin drugs, right? So this is Lipitor, Mevacor, Crestor, Zocor, Vytorin, that kind of thing. The FDA issued new side effect warning labels this year regarding the increased risks, brain-related risks, associated memory loss and confusion, an increase in blood sugar levels, as well as new onset diabetes. One prominent cardiologist described this kind of Faustian bargain: yes, fewer heart attacks, but more diabetes, right? With all the memory loss and confusion caused by these drugs, folks may have forgot there's actually a way to reduce the risk of heart attacks and diabetes at the same time. Call it the plant-based diet. All right, now cholesterol is just half of the heart disease story. The other half is inflammation. Right? We've known for 15 years that a single meal high in animal fat, sausage and egg McMuffin was used in the original study, can paralyze our arteries, right? Cutting their ability to relax normally in half within hours of eating animal products. The whole lining of our vascular tree gets inflamed and stiffened, right? And just as that inflammation, so here's hours, right? 1, 2, 3, 4, 5, 6. Just as that inflammation, right? Just as that crippling of our arteries starts to finally calm down after 5 or 6 hours, lunchtime, right? And then we may whack our arteries with another load of meat, eggs, or dairy, right? And so most people are in this chronic state of low-grade inflammation, increasing risk for these inflammation-related diseases like heart disease, cancer, diabetes, one meal at a time. Does the same thing to our lungs. Right? Again, within hours, inflammation in our airways. A single meal causing internal damage, not just years down the road, but literally right then and there, that day, within hours of it going into your mouth. And just this year, we finally figured out, we finally solved the mystery as to why. And it doesn't appear to be the animal fat itself. And it's apparently not the animal protein, which is what's implicated in the inflammation from arthritis. Right? So if it's not the animal fat, it's not the animal protein, what is it? The whole thing is a crazy, cool detective story that I'll be putting in a series of videos next week, actually, July 4th, July 5th, July 6th. But I'll just cut to the chase, spoiler alert. After a meal of animal products, people suffer from endotoxemia. Their bloodstream becomes awash with bacterial toxins, known as endotoxins, that are present in the animal products. So, I mean, no wonder our body goes crazy. These dead meat bacteria toxins aren't destroyed by stomach acid, aren't destroyed by pancreatic enzymes, right? Aren't destroyed by cooking. They tried boiling meat for hours, still didn't work. And so these bacterial toxins were found to be highly resistant to cooking and our body's best attempts at acid and enzyme digestion. Now, the animal fat actually does play a profound role in this whole process by ferrying the bacterial toxins present in the meat through the gut into our system. So the reason animal products trigger immediate inflammation appears to be because they're so loaded with bacteria that can trigger inflammation dead or alive, even if they're fully cooked. Right? And then saturated animal fat then boosts the absorption of these toxins into our bloodstream. So now that we know what's going on, what do we have to do? Well, from a 2012 follow-up, the most obvious solution to this metabolic endotoxemia, okay, well, we can reduce saturated fat intake, which in this country is mostly cheese and chicken, but the Western diet is not conducive to this mode of action, and it is difficult for patients to comply with this request. Right? So what? Let's not even tell them, right? I mean, this patronizing attitude in the medical profession of, oh, patients won't change their diet or stop smoking. I mean, even if it's going to kill them, so why bother, right? That attitude may be one of the real leading causes of death. But let's get back. But let's get back to the official list and take on cancer next.